It's the same intervention that we launched yesterday on 24th March during the World TB Day, where we are giving this, we will start providing the same drug to all people living with HIV who do not have, who we have tested and we find they do not have tuberculosis, so that it prevents. So for children, that's a key prevention measure. But another important thing in ensuring that we control the spread of TB in children is really health education, and using children as a focal point for health education, taking messages through the children. Children are very amenable to messages, and they even they can take them from school to their parents. And with that, they can be able to assist in diagnosing somebody in the family who has been coughing for a while and has the disease. And after the child is able to, we've diagnosed the child to have the disease, then we have treatment that is given for a duration again of 6 months, and the children, the outcomes are also very good.
Now the 6 months is for an adult who is already suffering from TB.
Yes.
This is now the treatment.
Yes, even for children who have TB disease, the duration of treatment is the same, 6 months. And
someone has to take, how is the medication? Is it a must you have to take it promptly as prescribed, or maybe you can describe a little bit of the prescription?
It's very important that you take the medication as you have been explained to by your healthcare provider. And that is usually once a day. The medication are given once a day. Missing to take the medication poses a very great danger, and probably it's something that we are going to talk next, is that you are likely to develop drug resistance tuberculosis if you miss the medication.
Yeah, that's where we need to go to the drug-resistant TB that has just been found just recently, that TB is also resisting, just like malaria was. And before I get there, I wanted to talk about TB has been found to be on low-income and middle-income classes in the world. Could you actually attribute, like you gave an example of Europe, they had all these issues before 1990, but now they've really brought it so much down at a very high rate. Could you say probably it's because we're in that category of middle income and low income, the majority of the population in the country? It could also be a challenge to you fighting TB in the country.
All right. Yes, I totally agree with you to some extent that TB afflicts people of low income, and for the reasons that I gave before, low income settlements, the overcrowding, that abates the spread of a disease that is especially spread through the air. So therefore any interventions that improve the living conditions and the economic status of a population do also have an impact, not only on tuberculosis, but on health as a whole.
Could we say probably it's because of the crowding, the way of living, the environment as such? Could that be maybe?
Yes. The main reason would be that the overcrowding that comes with that, but also undernutrition is also a factor in that. In people with low income. But also other diseases are also prevalent in people with low income. So disease states in all their varied states will affect people with low income. And therefore, efforts by the government that we are seeing to improve the economic status of the population will therefore resonate well with improving the health status, including tuberculosis and many other diseases.
Okay.
Yes.
Maybe as we finish, maybe you could tell us more about the bacteria itself, TB, how it really actually, should I say, develops or multiplies itself in darkness and such alike and overcrowded areas. You could talk about that shortly before we go to resistance.
Yes, thank you for bringing it. That's very correct. That generally sunlight, or what other people call UV light, kills the bacteria that causes tuberculosis. And therefore, in the absence of that, the bacteria will therefore generally tend to remain in a dormant state and be able to spread. And that comes to the issue we said about poor housing conditions. So in poor housing conditions, the houses are all together, there's poor light that gets in. If somebody coughs up the bacteria that causes tuberculosis, they'll remain suspended to the air, they will not be exposed to sunlight, and they will not be killed.
And how long does it stay active in that dark room for someone else to come and inhale and still get it?
I can't give you the exact time, but I can tell you that tuberculosis, if you have the disease and you cough it, it can remain, the bacteria can remain suspended in the air for up to 24 hours before. So
before it dies,
before it dies. That's why in some hospitals and in some in some hospitals, they use UV light, a UV light source where there are many patients of tuberculosis in the building, so that if somebody coughs out, then it kills the bacteria.
But the best UV light is the sunshine, like you said.
Yes.
Okay, so let's go to resistance. Why do we see TB resisting drug? It never used to do that before. Now, why are we having that? Before we go to costs, because I have actually seen your report that it's very expensive to treat MDR, or should I say multi-drug resistant TB.
Thank you for that. Actually, drug-resistant tuberculosis or drug resistance of any other disease is not a new phenomenon. It's a phenomenon that has been there. And indeed, even when they started doing TB treatment, conducting TB treatment in the early 40s, there were still aspects of resistance because they started with one drug, then they add on the other drug. So that's why in treating tuberculosis, we use very many drugs so that we do not develop resistance. But I said the main cause of resistance right now would be that the patient is not taking the drug as prescribed by healthcare provider.